The parietal cells of the stomach contains gastrin, histamine, and acetylcholine receptors. And when acetylcholine, which comes from the vagal postganglionic nerves, and gastrin, which are secreted by G cells of the antrum, bind to the receptors in the parietal cells, this leads to an increase in calcium in the cytosol, which stimulates protein kinases that promotes the hydrogen-potassium ATPase, or proton pump, to transport hydrogen into the lumen in exchange for potassium. Then hydrogen binds to chloride to form hydrochloric acid. Meanwhile, stimulation of the enterochromaffin cells, which are in close proximity to parietal cells by gastrin or acetylcholine, stimulates release of histamine from the ECL cells, which then binds to the H2 receptors on the parietal cells. This results in activation of adenylyl cyclase, which increases CAMP and activates protein kinases that stimulate hydrogen secretion by the proton pump. Which leads us to the drug of choice for PUD, which is omeprazole, that is a proton pump inhibitor that causes more rapid symptom relief and faster ulcer healing for duodenal and gastric ulcers. If PUD is associated with H. pylori infection, the most effective regimens for its eradication are combinations of 2 antibiotics and omeprazole. The most commonly recommended regimen is a 14-day regimen of triple therapy, which includes omeprazole taken twice daily, clarithromycin 500 mg twice daily, and either amoxicillin 1 gram twice daily or metronidazole 500 mg twice daily. And after completion of antibiotic therapy, omeprazole should be continued once daily for 4 to 6 weeks to ensure complete ulcer healing. If PUD is associated with intake of NSAIDs, omeprazole and H2 antagonists provide rapid ulcer healing as long as NSAID intake is discontinued. If, however, the patient requires continued NSAID therapy, omeprazole is usually preferred because it provides more rapid relief of symptoms, has the strongest acid suppression, and heals ulcers more quickly than other agents. Omeprazole taken once daily is effective in reducing ulcer incidence and complications in those taking aspirin or other NSAIDs.